By a show of hands, how many people have heard of the disease called tuberous sclerosis? This disease is very rare as it only affects 1 in 6,000 newborns in the United States. When you leave here today, you will have learned what TS is, how it is diagnosed, the treatment options, and what complications that can occur along the way. As I said above, tuberous sclerosis is a rare disease that causes tumors or growths on the skin, brain, eyes, kidneys, heart, and on the lungs. It all depends on where the tumors are located on the organs, where some can be cancerous but most are non-cancerous. It can cause mental problems, but the signs and symptoms of the condition varies from person to person. Some signs of tuberous sclerosis can either appear during childhood or adulthood. Some signs of TS includes seizures, white spots on the skin called hypopigmented macules, a rash on the face that may look like acne but is called facial angiofibrosis, problems with the kidneys, areas of very thick skin which is usually located on the back called a Sjegren patch. They can also have mental disabilities. There are 4 main ways that doctors can use to diagnose someone with tuberous sclerosis. First, they may do a CT scan or an MRI of the head to check the brain for any tumors, which is like this on the picture. You can see the little white spots with the arrows. Those are the tumors. Second, they can do a CT scan of your chest or an echocardiogram of your heart to look for any tumors or growths. Third, they may do an ultrasound of the kidneys to see if they can find any. Fourth, doctors have an ultraviolet light examination done of the skin to help identify any white spots that come with tuberous sclerosis. Tuberous sclerosis is a genetic disease that can be inherited from a parent with a TS, or it can be a spontaneous genetic mutation. It occurs with an altered TSC1 or a TSC2 gene. Children who has a parent with TS has 50% chance of inheriting it as well. People who have tuberous sclerosis will have complications along the way that can be severe or non-severe. First complication that may occur is excess fluid in or around the brain. When a brain growth blocks the flow of the cerebral spinal fluid within the brain, it causes a buildup of the fluid in the cavities between the brain, which is called a condition called hydrocephalus. With the different signs and symptoms, they could include an unexpectedly large head, nausea, headaches, and can have some behavioral changes that may lead to death. The second complication may be having some heart conditions. These complications get so bad to where they could all lead to death. Tuberous sclerosis can have some treatments to help along the way, but having TS is a lifelong condition. The first treatment option is to be put on medication to help control some of the seizures, but children who may need to get surgery on their brain to help control the seizures. Second treatment plan for the brain tumors can be treated with medication. The kidneys that have tumors on them are often treated with surgery. Another treatment option are the small growths on the face that can be removed with laser treatment, but they also tend to come back. Tuberous sclerosis is a lifelong condition for anyone who has it, but they do live their life normally. Some people who have TS more severe will need to have assistance for the rest of their life. To illustrate that this will be a lifelong condition, we looked at the TS, what TS is, what it takes to diagnose, and the complications along the way, and the treatment options. So next time someone asks you to raise your hands if you have heard of the disease called tuberous sclerosis, do so.